Welcome back to part 2 of our conversation with the amazing, the inspiring Dr. Makda Majette.
Thank you.
Dr. Majette, you're welcome. Dr. Majette introduced herself in part 1 and led us on an amazing journey where she was already a global traveler, curious about the world, informed about the world through her experiences with her dad as a diplomat, and used those experiences and continued to grow those experiences through undergraduate and into medical school. And her lessons that she shared with us on persevering even when you hit that obstacle for the first time and you're not used to it because you are a high achiever. High achievers do take disappointments a little harder than those that are more experienced in having disappointments. And for the second part, I'm just so excited to learn what happens now that Dr. Majette achieved her goal. She's a medical doctor. She's board certified in family medicine. She's studied public health, and she's going to bring that wealth of experience to the world and that passion that she brought from that experience watching Nelson Mandela be inaugurated as a child to her own vision and version of fighting for equity. Welcome back, Dr. Majette.
Thank you. That was a wonderful segue and an excellent question. And I think you just summarized everything so wonderfully. So now, as a board certified family physician, I would say in my first so we finished residency, board certified, starting my first job outside of residency, I was trying to figure out what was best. I knew I wanted to stay in this area. I'm in Miami, Florida. I love this area because it's very diverse. I also, of course, like the warm weather, but I love the cultural melting pot that we have here. And so I knew I wanted to stay, and I also had a lot of connections from my residency program, and I wanted to stay in touch with those people. So I decided to take a job doing HIV primary care. And the reason why I chose that was I was very passionate about HIV being part of our regular primary care because it's such a stigmatized disease, and I feel like it shouldn't be because it's very common. And treatments have gotten so much better than they have been when it was initially discovered. It's not a death sentence. So I felt passionate about being able to provide comprehensive care to people with HIV. So when I got the position, I worked for the AIDS Healthcare Foundation previously, and I was very passionate about it because it's also a global health organization. And before I, right after my interview, actually, after my interview, I did a 6-week rotation in Ethiopia at Paulos Hospital, which is it's St. Paulos Millennium Medical College in Addis Ababa, Ethiopia. They actually have a lot of funding from the Bush administration. He did great work as far as increasing the access to HIV prevention and HIV medication globally. So they have HIV resources there within the hospital. And when after my interview, I went to Ethiopia for that 6 weeks. I rotated with the HIV clinic in the hospital there. I also did some women's health in the clinic there as well. We work with refugees and women's health as well. So I was so surprised when I got to the hospital. I believe in signs sometimes, right? So at this, this is like, so I got to the hospital, and on my first day, 6 a.m., I look and there's a HIV test, AHF, AIDS Healthcare Foundation testing truck right in front of the hospital. And I'm like, well, that's the organization that that I had my interview for already, that I was interested in working for. And then now I see their truck outside the hospital as well. And they provide testing and treatment regardless of people's ability to pay. And that's something I was passionate about as well, is that, the people that are able to pay do contribute, but they're able to utilize that funding to help people all over the world that are not able to pay, and also within the US that are not able to pay. So that experience, seeing them there, made me even more excited to join the organization. So when I did get back from that rotation abroad, it was 6 weeks that I spent in Ethiopia at that time. It was in 2019. Before the war. So I did spend that time in 2019 before the war, and then I came back to the US, and I started my job that August at the AIDS Healthcare Foundation, where I provided primary care to people with HIV here in South Florida, regardless of their ability to pay. And I was surprised by the extent of HIV that we have here in South Florida. It was nothing compared to what I saw as a resident in the hospital. We had cases in the hospital on the inpatient service every now and then of people coming in with AIDS-defining illness on the inpatient, even on pediatrics sometimes, but it was not as extensive as I did see working in an HIV clinic, right? Because people were coming directly from the hospital to me for their follow-up care. And I did have a long, extensive list of patients. I did not only see people with HIV, but a predominant portion of my patients had HIV. So I was surprised, and I learned that the area where I worked in Fort Lauderdale was number 2 at that time, 2019, as far as new diagnosis in the whole country. Baton Rouge, Louisiana was number 1 for new diagnosis, and Fort Lauderdale, Florida was number 2. So we were seeing a lot of cases, and it was very shocking to me because I expected to see people that were well managed, that had had taken, either they're newly diagnosed and they're still pretty healthy, and then we just start the medication and they stay healthy, or people that were diagnosed many years ago, which I did have people like this, people that were diagnosed many years ago that were just maintaining and doing well, which I did have patients like that too. We had patients that were doing well in their 70s, 80s, doing great, at diagnosed a long time ago, but doing great. So, but I was surprised by the amount of new diagnosis with AIDS diagnosis, and also people that were just not adherent or having issues with the adherence. It was huge. And having the AIDS diagnosis and not adherent, but still coming for care regularly. So it's if you're still coming to care regularly, you would expect them to be improving, doing better, but that was not the case for everyone. And I was also very surprised to see in person that discrepancy as far as the disproportionate effect of HIV in different communities. So when I'm working in that community, I can see I took care of patients of all races, but you can really see when you're in the community how even though, so I'll just say that the people that were not doing well tend to be of ethnic minorities, Black, or impoverished compared to people that were able to, of course, had more other ethnicities or people that were economically able to do better. Even though we provide the medication free, and there's also great programs such as the Ryan White program that provide the medications for free. The labs, were free. There's assistance with housing. There's a lot of resources available, but you still see these disproportionate outcomes, and you still see this even with treatment or even people that are actually in service. So seeing that was somewhat difficult. Because I think a large part of that is because of the stigma in different communities. Because especially with the Black American population, even though people were in treatment, there was a lot more resistance to taking the medication. And I think it's also because of that stigma or not wanting to feel like they're actually sick, or that they have the condition, or some people even believe that that we're hiding a cure, or that there's a cure elsewhere, or you learn a lot about different belief systems within caring for people with HIV. So that's part of it, but just in general, just as statistics to put out there, although Black Americans are only 13% of the population, they're 40% of the people living with HIV in the United States. So the prevalence rate for Black Americans in the US is 7 times higher than white Americans. And there's nothing biologically different, right? It's just that all those social determinants of health also come into play, and you really see that when you're when you're taking care of patients. So part of that is, like, of course, access to healthcare, the neighborhoods and the environment that the people live in. Access to education, education in general about HIV not being a death sentence, or that the treatments are good. You don't have to worry about their side effects are minimal. Um, the other issue, as far as social determinant health, is that economics is what I spoke about a little bit before. It's like you see that income discrepancy also playing out as far as treat the access to care and just maintaining that viral suppression, and then the social aspect, because it seems like the community is not as accepting of people with HIV in different communities.
So, I mean, very clear, right? HIV is definitely one of those diseases you and many of our guests have spoken to that really lays bare how inequity plays out in a healthcare system, how it plays out globally, how it plays out and intertwines with all kinds of marginalization, right? It really is one of those markers that help us see how caste plays a role in our society and in healthcare and in whole political systems. But with HIV, I hate to say I'm old enough to have trained and been a doctor during the time when HIV and AIDS was synonymous. There was no treatment. And to have an HIV test was usually secondary to already having an AIDS defining illness. And at that time, really having a death sentence, right? There was no treatment. And wonderfully and gloriously, it has evolved to HIV very much being a disease that you can live a long and fruitful and healthy life with, and that you are not any longer a social pariah that's in danger of infecting others. But socioeconomic factors play out in where you still live in that trajectory. If you are of a higher socioeconomic class and race, you live in the 2024 of that trajectory, while there are people globally that still live in the 1980s and 90s for that HIV/AIDS trajectory, and then for our all kinds of groups of people, right? So HIV is super prevalent in people that use drugs, prevalent in our homosexual population, prevalent in our transgender. So these are all people that society is already marginalizing and stigmatizing. And then we ask them to trust us, trust a healthcare system to care for them and to make them better and to not further stigmatize them. And really, I think much of the barrier comes down to that, to trust. What's the message that they have gotten? And can they trust a healthcare system? And is there enough resources around educating the entire community so that you're not also stigmatized by your community? So there's a lot in there. And HIV and AIDS is definitely one of those diseases that make healthcare inequity everywhere, including in the highly resourced first world countries like the US.
Yeah, I think it just highlights like how inequitable healthcare kind of is in a way. It kind of shows, it puts a light on how inequitable healthcare is. And it also shows how it can be like, a lot of government there's so many government initiatives, and a lot of funding into HIV. But if that was a little bit more comprehensive, because someone with HIV may not just have HIV, right? So that could be one of many comorbidities. And also people with HIV are more at risk for other diseases, right? So but as far as funding is concerned, as far as government resources, Ryan White program, it's mostly for the HIV only, right?
For the one disease in the whole person.
Right. We're whole people. So it's nice. It's a way to, if people living with it would be, it highlights how comprehensive we can be in certain ways, because people with HIV are able to get some resources that people without HIV are not able to get in a way. Someone impoverished, homeless, without HIV will not be able to get, Ryan White, where they may get help with housing, they get help with mental health resources, they get free doctor's visits with me, blood work, right? So yes, it's a chronic disease, but it's not a death sentence the same way it was. But it does highlight those disparities in healthcare, and you could think that we can do more. Not yes, we need to eliminate HIV within the U.S., but it also shows what we can do to help other people as far as like a baseline primary care or improving primary care within the US as well. Because there is that funding for people with HIV, but if you don't have it, you don't have that same ability to access certain resources, which is I found interesting as well. I want to talk a little bit about, around 2019, I had had finished that rotation. I started a job doing HIV medicine, and then in Ethiopia, then there was a war that started in November 2020. Of course, we had the pandemic, and the war in Ethiopia, it really affected my life in many ways, because I still have a lot of family there. So my grandmother is there, aunts and uncles, and there was no power, there was no access to telecommunications services, and of course that also affected And while there was no power or access to telecommunication service or internet or able to call your family and see how they're doing, we were hearing about war. We're hearing about bombings, especially of healthcare facilities that were bombed first, healthcare facilities, and also religious sites. And religious sites were looted, and healthcare facilities were destroyed. So that really made me, of course, first think about the people in that region, how they will get health care because the facilities are destroyed, even if they're in the middle of a war. Of course, in a war, you think about people with injuries, or you think about people who do need medical care or medication, how they're able to access that medication. And yeah, so that was a very difficult time. There's still some areas that of course, it has not fully recovered in certain areas. But fortunately, the war has ended. There was a peace treaty that was signed in 2022. And I'm able to contact my family, but there was periods of time where we were not able to even reach family to see if they're okay. And it wasn't until a couple months ago, yeah, this year, 2024, that my family member who lives in the capital was able to visit that Tigray region to check on family members. And when he did check on family members, unfortunately, we lost some family members that were just killed in the war, in their community, not even as soldiers. And we also had destruction of property, as far as like the home with bullet holes in the home. And then just learning about all of those things, you see how every aspect of life, especially health and healthcare, can be just cut short in times of conflict. And we see how much destruction can happen with conflict and war, especially when it's not just between soldiers, or it's not just in, I guess, I don't know if war is
It
ever
never
confined.
is.
Yeah, it's ever confined because they don't put people on like a football field and say, okay, fight. And, it's always involves civilians. You're always going to have suffering outside of people who choose to go and serve their country, as far as fighting for that war. And even if you do have people that go and choose to serve their country in whatever way, their families are also affected. So it's always going to affect everyone. Yeah. So that, of course, affected me in different ways. Like just knowing that there was a war going on, and that people were, especially people close to me, I was not able to get in touch with to see if they're okay, and also to know that. Healthcare facilities were being destroyed when I had just been in Ethiopia the year prior to try to help and learn, and also learn about the healthcare facilities, and they were doing amazing things in different parts of the country, as far as enhancing healthcare in the different regions with um, healthcare workers in different ways. So it was really disheartening to see this step backwards, as far as when you get into conflict. You see a step backwards in so many different ways. And as American as well, I'm American, so you also see your, I guess, different colleagues or friends that are not speaking for peace, right? So that was another hard lesson to learn? Or because I mean, people are people, but when you see that there's no universal call for peace, or that people are not encouraging peace, but people are kind of encouraging continued destruction of a certain group or area, it kind of makes it even more disheartening when you really want just to see people thriving and doing well, and you want to see that country doing better, and you want to see people being taken care of, and that their health care is addressed, and so that those things were very hard concepts for me to grasp, because I think, like you said, you think that life was supposed to be fair in different ways in the beginning. You did mention that, but I would think that most of us had the um, same goals as far as wanting pros- prosperity for a majority of the people, regardless of their ethnicity. And but that was not the case. And even with people I know that had very different views, so I was surprised that people I know and had was very cordial with, they had very, very different views than me, and they were okay with my family being not me not knowing how my family was, so so that made me see people in a very different light, unfortunately. But yeah, so I would just say, with that, I also had to learn, like, that it's not something, even if there's that difference, it's very important to not it's another lesson, like, not to hate people, right? And not, like,
You're the joy doctor, Dr. Majette. Actually, I'm feeling a little guilty that I took you on a very long tour down some dark
some
corners,
dark
and you are the joy doctor. Dr.
right,
Majette actually focused quite highly in her coaching and in her business on wellness, self care,
right,
and appreciating joy. So these two things coexist,
right,
darkness and light.
right,
And she uses the lessons of darkness to fuel the light.
right,
Light cannot come from nowhere. It has to there has to be fuel. Something needs to burn. And she uses the darkness, all of this, all the things we've talked about, that perspectives, the global perspectives, the inequities she's seen, to fuel a career that is very much focused on joy. So I feel a tiny bit guilty for bringing you down the dark tunnels.
no, it didn't bring me down, but what it taught me was to not to feed into that separation, to not to feed into that isolation, and to not feed into animosity towards other people, regardless. And no matter what they have done to, me, my family, or whatever, as a, political level, um I had to, like, also lean into, Nelson Mandela again. He forgave everyone, and Jesus, and whoever, lots of other people. He forgave everyone regardless of what he went through. And he went through a lot. He was in prison for a long time. He suffered way more than what I experienced. And you're not able to move forward in power and peace and love and joy without that forgiveness. And as a country, as far as, like, I'm American, but as far as how I see it, as a descendant of Ethiopian as well. My mom's Ethiopian. So I see it as a country, like, there has to be that forgiveness in order to move forward as a nation, because it was a civil war, right? So it was the country of Ethiopia, the country of Eritrea, that were attacking a small region within Ethiopia called the Tigray region. So even if the people of that small region were able to defend themselves and completely win that war, they would not be able to, it would be very difficult to exist on their own because they're a small, landlocked community region. So there has to be that forgiveness and understanding and moving forward in some way. And we all have to do that in our own ways throughout our life in different ways. It doesn't mean you have to, accept everything or, accept everything in certain ways, but you can forgive and move forward because in different ways. So I had to learn that as well. And it was not easy. It took a long time to just be like, you know what? I'm not going to take on that same animosity because it just fuels negativity, and I'm just going to forgive and move forward. And that of course brought me to more joy, right? So in different ways. So I have my podcast, which is the Embracing Joy podcast for high achieving professionals. And I'm very passionate about it because I see a lot of high achieving professionals, like myself in my younger years, go through feeling joyless, burnt out, isolated, or feel like they can't find joy because they care more about giving themselves to their job, to their career, to their patients, but they forget what's so important to them or what lights their spirit or what makes them happy. So I'm passionate about helping people learn what makes them happy and helping them to prioritize that and adding that into their day so that they can find more joy in their lives.
And if you're going to be coached in joy and how to achieve joy, you want to be coached by somebody that knows what it's like to experience hardship. If the person coaching you in joy has had everything work out great for them their whole life, they cannot really help you in your moments where you need to find joy again. So Dr. Majette is absolutely the expert that you need, right? If you're having difficulty coming back from really, it's not it's not just a perspective, right? People are experiencing very, very morally, ethically, emotional, healthcare, burnout related issues, and they're real. And you can go through very real hard things and still find a place of calm, stillness, and peace for yourself, and then hopefully radiate that for the people around you. And I think Dr. Majette and I probably aligned, right? That is how you create peace. You can't create peace by making people pay for what you've decided are the wrongs, right? That's what's gotten us centuries of war, conflict, and suffering. I do think you do point out, even in your journey, the importance of the next generation and the importance of perspective. I want to thank you for sharing those difficult parts because it helps people that really live a completely different existence don't even know what it's like to have blackouts for a period of time. I mean, we have blackouts in the US and it's like a big disaster. And many people in the world live with blackouts all the time. It's like, and you move on, right? There's just so many things that people don't understand. What is it like to have all of your infrastructure disrupted, your water, your electricity, your ability to get help, to call 911. We don't understand these things. And so I want to thank you for at least sharing those perspectives, because I do think that's the way forward, is to get more people to understand that we all operate and experience the world differently. And that's just something you need to understand and to be open and the next generation, because you were the next generation. You were the Mandela generation. And I do think we have another generation, and that's why I have this podcast, because I want them to have health equity and global health in their minds from day one, and to carry that through their careers. Because instead of people not being able to go into conflict zones and not have that perspective, what if we can? What if we can help with telehealth? We can't fix everything, but we would have perspective. What if we can be there and supporting the people on the ground and feeling how helpless it can be, and trying to bring all our best resources to help people all the time? It would change our perspective as not just a healthcare community, but as a global community. And I do think that's the way forward for peace.
Definitely, especially in the case of Ethiopia, and especially in that Tigray region after the war. So many facilities were completely destroyed and there was so much destruction. So now, in the rebuilding phase, of course, they will need. It doesn't have to be that you go into the conflict zone, but once it's safe and they're rebuilding, they need that support, because a lot of physicians, there was so much brain drain because of the war, right? So a lot of people, anyone who had the means or capabilities to leave to survive, a lot of people have, right? So left the country, and maybe they've gone to neighboring Kenya, or they left that region and went into the capital where they could survive, because not even there was not even food supply. So a lot of the food supply was also destroyed. They were targeting of farmers and their fields. And so that was like one of the key areas of destruction that it caused mass starvation in the area. It's almost as bad or worse than the 1980s when I was born. There was a major drought in Ethiopia. However, the starvation has been as bad or worse now in 2020, but without the same global public outcry that we had in the 80s. So that global public outcry for the 80s with the We Are the World and Michael Jackson and the imaging, it wasn't there this time around. And I was surprised with that as well too, because I was born, that was around the time I was born. I was born in the 80s. I'll just say the 80s. I was born in the 80s. I'm not get specific, but I was born in the 80s. And the reason why my parents even met was because my father went to help because of that global outcry. He's American, but he went to help in Ethiopia because there was that global outcry, because of the drought, because of that severe the starvation that the kids were facing. And he went to help. And that's how he met my mom, and that's how I exist. However, with this war, which is so recent in 2020, where we have more access to technology, we have video, we're doing a video podcast, which is great. We have this video, we have all of these things. There was not a global outcry. I think that's also because there was lack of access to telecommunications during that time too, right? During the first part, but we know now, but there's still not as much global outcry. Yeah.
Yeah. So anyway, we're getting deep here, but lack of telecommunications is part of how you control the narrative for wars. But yes, for sure. So we got way down deep there in the rabbit hole. Dr. Majette, tell us all the ways our audience can see your content and connect with you.
Well, first of all, thank you so much, Kim. This is wonderful speaking with you and your audience. You all can find me on my Instagram, which is at Doc Majette. You could find me on YouTube, where I have my episodes for the Embracing Joy podcast. It's at Doc Majette on YouTube. Those are the main areas where you can find me. I'm also on LinkedIn under my name. And that's it. Those are the areas you can find me right now. This has been wonderful. It's a great discussion with you. I know we did get kind of deep, and I could talk to you for hours and hours and hours. So
yeah, we might have to have sub conversations with subtopics to keep this going.
Yes, definitely.
Dr. Majette, such a pleasure. Look, thank you for your open heart and sharing so openly and deeply with our audience, bringing so much wisdom and global vision to everything you do. Very grateful. Thank you for being on the podcast today.
Thank you for having me. It's so wonderful to speak with you. And like I said, the work you're doing globally to improve access to medical care is just phenomenal. And I'm looking forward to seeing your work blossom all over the world.
I appreciate you. In our podcast, we frequently highlight and explore the vital role of collaborations between public and private enterprises, backed by government support for sustainable health equity innovation. If you are a minister of health, public health officer, or a dedicated public official working to enhance healthcare access and equity, please, we want your voice. Come share your voice and your perspective on our show. Share your insights, perspectives. Contact us at Dr. T, T at haew.org to secure your spot. Listeners, please, we need your support too. Share today's episode with a friend. Share Dr. Majette's wonderful story, her perspectives, all the great work she is doing. Leave us a review and share your thoughts. And if you're interested in being a guest, please email us. You can go to https://haew.org to learn more, join us, partner, or contribute. Let's amplify the conversation for a healthier and more equitable world today.